But with the new administration working on containment measures during the transition, we might have a chance to turn things right side up. Biden announced his coronavirus task force today, a team of 13 physicians and health experts, and he met with them virtually today. We also got this huge news. Here's the headline, quote, Pfizer's early data shows vaccine is more than 90% effective. Quote, Pfizer plans to ask the Food and Drug Administration for emergency authorization of the 2-dose vaccine later this month. By the end of the year, it will have manufactured enough doses to immunize 15 million to 20 million people, company executives have said. A vaccine with 90% efficacy is a very big deal. But now the question becomes, how do we distribute this? How do we get it to the people who need it to get things under control? Joining us now is Dr. Richard Besser. He's a former acting director of the CDC. Dr. Besser, good to see you here. Thank you for being with us, sir. I love this news. It is. There's no question this is fantastic news. There are some specifics we have to understand. First of all, 90% efficacy is pretty good. People think all vaccines are effective against all things, but they're not. Bill Gates a few months ago said he was looking for a combination of vaccines that would together get us to about 95% efficacy. To have one vaccine with 90% efficacy is a very big deal.
Yeah, Ali, I always like to wait for independent scientists to verify the data. This is company data and an announcement. But if this holds up, a 90% effective vaccine is a game changer. This is on the order of the kind of protection you get from measles vaccines, and measles vaccines are extremely effective at controlling disease. There are a number of hurdles to pass. This was data based on 7 days following the second dose of vaccine. So they'll be looking again to see at how well it protects people 28 days after having received that second dose. And they'll be looking at safety data. The FDA was clear that they want to see 2 months worth of safety data before they would consider any vaccine for approval. So those are important pieces of information to come. The other piece, Ali, is looking at how it protects not just at overall infection, but at serious infection, because we know that most people who get COVID, thankfully, will do well with it. They want to make sure that it's just as effective against serious illness. That's right.
So I appreciate you pointing out that this is company data. Unfortunately, for most of this COVID period we've been in, we've mostly got company data, companies announcing what they've been doing. That's the stock goes up, and we don't know what that's about. So we do need proper peer-reviewed data. There is something else about this vaccine. It's 2 doses, and it needs to be kept at negative 94 degrees Fahrenheit, which is sort of colder than trucks run at. It's colder than the fridge at your pharmacy runs at. So there's a sort of a separate infrastructure issue. How do people get a vaccine that has to be kept that cold?
Yeah, I mean, this is a real challenge. You need dry ice to be able to keep a vaccine at that level. The company has developed some containers to help transport this vaccine at that level. But many hospitals don't have freezer storage that will keep things at that level. So, there's a real challenge in getting this out to people who need it, to getting it to rural communities. If you think about vaccine distribution on a global scale, and countries where there's large rural populations and less infrastructure, it will be a real challenge. But these are challenges that have to be met. In this country, we can't let a vaccine go out and have it just go to those people who live in places where they are able to get that cold storage. We have to be able to deliver this to people in all communities who are at highest risk.